Gentlemen, there's a daily habit most men never question, because it feels too basic to matter. The way you urinate. But if you're over 50 and you've noticed a slower stream, lingering drops, pressure in the lower abdomen, or more nighttime bathroom trips, this habit may be quietly working against you. Not because you're doing something wrong on purpose, but because no one ever explained how the urinary system is actually designed to empty. I'm Dr. Greg Shawn, urologist with 25 years of experience. Today, I want to show you how small changes in posture, breathing, and timing can reduce strain on the bladder, calm the pelvic floor, and make urination easier, without force, fear, or embarrassment. This isn't about masculinity, it's about coordination. Let's clear up the most damaging myth first. Many men believe urination is an act of force. Get to the toilet, push hard, finish fast, move on. That power pee habit often starts when the stream slows slightly in midlife. Instinct says, push harder. But here's the truth from urology. Urination works by relaxation, not force. The bladder is a smooth muscle. It contracts automatically when your nervous system signals safety. The pelvic floor, on the other hand, must let go for urine to pass freely. When you hold your breath, brace your abdomen, bear down like lifting something heavy, you send a tightening signal through the exact area that needs to soften. That mismatch creates resistance. At first, you may see a stronger stream for a moment. Internally, pressure rises, the outlet narrows, the bladder works harder. Over time, this trains irritation, hesitation, dribbling, and nighttime urgency. Here's the pattern I see weekly in men in their 50s and 60s. The stream slows slightly, you lean forward. Hold your breath. Push. Months later, the bladder becomes more sensitive. The pelvic floor stays guarded. Nighttime trips increase. The end of urination feels incomplete. None of this is inevitable with age. Much of it is mechanical tension layered on top of normal change. Another habit that worsens this is emergency holding. You ignore early urges because you're busy. By the time you go, the bladder is overfull. You rush and push. Overdistension plus force trains urgency and resistance. The system learns extremes: too full, too tense, no rhythm. Posture matters more than men realize. Many men urinate standing with hunched shoulders, locked knees, weight forward on the toes. This tightens the abdomen and hips. The pelvic floor responds by bracing. Try this instead when standing. Feet shoulder-width apart, knees unlocked, weight slightly toward the heels, belly soft, jaw relaxed. If standing feels inconsistent, sit. Sitting often allows better pelvic floor release and more complete emptying, especially if the prostate is enlarged. Sit with feet flat, lean slightly forward from the hips, spine long, elbows resting lightly on thighs. This isn't a rule against standing. It's permission to choose what lets your body relax. One more important point: hovering. Hovering keeps muscles engaged. It's like peeing during a squat. The stream weakens. You push harder. Resistance rises. When you can, sit fully. When you can't, soften and breathe. Many men unknowingly hold their breath when they start to urinate. Breath holding tells the nervous system, danger. The body clamps down. To reset, exhale slowly before starting. Keep the exhale flowing as the stream begins. A longer exhale activates your relaxation system and signals the pelvic floor to release. If the stream hesitates, do not push. Add 2 slow breaths. Often the flow begins as tension drops. Your bladder does not need help, it needs space. Some men practice starting and stopping the stream as training. Occasional awareness is fine. Making it a habit is not. Frequent start-stop patterns teach the pelvic floor to clamp. Urgency and hesitation worsen. Your goal is one uninterrupted flow. At the end, don't chase the last drops with force. Hard pushing against a closing outlet often creates more dribble, not less. Instead, pause for a few seconds. Breathe, let shoulders drop. If standing, shift weight gently left to right. If sitting, lean forward slightly, then return to neutral. Calm finishes retrain faster than forceful ones. Hydration timing matters. Drinking very little all day, Then loading fluids at night sets up nocturia. A better pattern: water in the morning, water mid-morning, water with lunch, smaller glass mid-afternoon, taper in the evening, add a short walk after dinner, limit fluids in the last 90 minutes before bed. Bladder irritants also matter. Excess caffeine, alcohol, artificial sweeteners, very spicy or acidic foods late. You don't need to eliminate them. Respect timing and quantity. Constipation also plays a role. A full bowel presses on the bladder outlet and keeps muscles guarded. Fiber, daytime water, movement, and a calm morning routine often ease both bowel and bladder symptoms. And finally, leave the phone out of the bathroom. Lingering keeps muscles engaged and disrupts nervous system signals. For the next 2 weeks, try this. Pause for one breath before starting. Exhale as the stream begins. Use relaxed posture, standing or sitting. No pushing, no stopping midstream. Calm pause at the end. Hydrate earlier, taper at night. Track ease of starting. Number of night awakenings. Progress may be gradual, but smoother starts and steadier nights are real wins. If you experience burning or pain, blood in urine, fever, sudden inability to urinate, rapid symptom changes, you should be evaluated. This guidance supports coordination and comfort. It does not replace medical care when red flags are present. Urination works best by relaxation, not force. Breath starts the release. Posture opens the outlet. When you replace strain with coordination, your bladder stops feeling like an adversary. Choose one change to start today. Just one. And if this helped you see something differently, share it with someone who could use a calmer approach to men's health. This is Dr. Greg Sean, urologist. Clear guidance, real physiology, and respect for the stage of life you're in.